Hi, and welcome back to the Wyoming Vein Specialist and Casper Medical Imaging YouTube channel. Thanks for tuning in. I'm Dr. Charles Boukley. This is Jesse, our lead stereotactic breast biopsy tech, and this is JC, one of our leads from the venous ultrasound team, specifically focused on looking at lower extremity venous disease. So a number of requests have come across that specifically targeted what it's like to have a venous mapping ultrasound. Some people aren't familiar with how invasive or non-invasive the test or procedure is, and we wanted to give you an idea of what to expect after your consultation and physical examination with respect to the venous mapping itself. So we're going to get started right now. Okay, so where we are now is we're about to start the venous mapping ultrasound. And as you can see, JC in her right hand has the ultrasound probe, and there's some gel on the end of it, which is typically warmed for our patients. And Jessie has her right leg turned out towards the side, or in external rotation. And the reason why, if you remember from our prior discussions, we're trying to find the greater saphenous vein, which is located with its own special compartment called the fascial sheath. Around it, it's like a saran wrap covering, and it follows the inseam of your genes. Okay, so we're going to scan down in just a moment here, but as you can see down below, Jessie is kind of toeing off. You can imagine if you were in a running phase that this would be the last part before your toes leave the ground. However, what we really want Jessie to do is relax her limb down and take all of the weight off it, using her rear leg, kind of like a big tree trunk, to hold that weight up and relax the limb. We don't want any excess pressure within the venous system, because when we start squeezing, which we're going to go through next, it's called augmentation. When we start squeezing, we don't want there to be any abnormal forces on that vein. So this is your classic anatomy of the arterial, deep venous, and superficial venous system. At the area of the underwear line or the inguinal ligament or the brief line is essentially where all of these structures come together to dive down deep into the pelvis in order to return the blood from the lower extremity back to the heart. This here is the common femoral vein. This here is the greater saphenous vein. And as JC slowly scans down, we'll see another small vein that's draining into the greater saphenous vein called the anterior accessory greater saphenous vein. There are a number of different normal anatomic variants, and this is pretty much classic anatomy for the lower extremity venous system. You can see these vessels are moving immediately next to the deep vein because these are the arterial structures. We're not going to focus on those today. Okay, so now you've realized that there's a third person here in front of me. This is Jessica, she's our nurse. And what we're going to do now is we're going to do the compression, or what's called the augmentation portion of this examination. The augmentation portion of this examination is extraordinarily important. It is the defining feature that allows us to characterize whether or not the veins are flowing in the appropriate direction from down below back up towards the pelvis. And the orientation on the ultrasound machine is that Jessie's feet are down here and her pelvis is up here. So the direction of flow we want to see is it actually moving here. Now, when Jessica squeezes, she's squeezing with Jessie in the standing or erect position. Why is that important? We want this squeezing episode, or this augmentation episode, to replicate what Jessie's body would see on a normal daily basis, walking and being in the upright position. That's the best way to characterize whether or not there's valvular failure or venous reflux. Okay, so now we need to compress the entirety of the limb. We want to start all the way at the top where the superficial system dives down into the deep, and that's called the saphenofemoral junction. JC, why don't you scan up just a little bit and show us exactly where that is. Greater saphenous vein, deep system, and then go longitudinal on it. And as you can see, the saphenous system dives down in and drains into the deep. Now JC's going to come down a little bit, and we're going to see that valve structure that is so ultimately important in this examination. You can see it's almost like a V lying on its side. Now, Jessica is going to squeeze either the end of Jessie's thigh or Jessie's calf where it's at the greatest size. And that way we'll be able to watch the blood flow in the appropriate direction back towards her pelvis. Okay, so what we're first going to do is we're going to show you the demonstration of the augmentation with Jessica squeezing the calf or the distal thigh, and we're going to be looking right here at that valvular structure, making sure it closes normally. So there are two different types of ultrasound Doppler interrogation of the venous valve. This is called color Doppler interrogation, and when Jessica squeezes, we're going to see a flash of color across the screen. Now, as we can see here, that was blue. Blue means down. Down is going back towards Jessie's pelvis, so that's perfect in the appropriate direction. And we're going to see a waveform replication of that blood flow movement. Go ahead and squeeze. Perfect. Now, we can see here that when Jessica squeezed, the blood shot down or back towards the pelvis. And then as the blood fell with gravity, when Jessica let go, that valve kind of bowed back on itself and then closed. And that's absolutely perfect. That's exactly what the valves in the lower extremity venous system should do, is when there's a pressure coming from above or gravity pushing blood in the wrong direction, the valve should close and there should be no flow thereafter. That's a normal examination. Please feel free to call us at 307-232-5054 and schedule your consultation. Remember, we'll walk with you until your legs are healthy again.